Good morning, and thank you for joining us. Today, the main topic of our briefing is our plan for booster shots. So I'll turn to Drs. Murphy, Walensky, and Fauci in just a moment. First, I want to provide a brief update on our fight against the virus. We continue to see a rise in cases driven by the more transmissible Delta variant, with cases concentrated in communities with lower vaccination rates. So this remains a pandemic of the unvaccinated. We know getting more people vaccinated is the best way to end this pandemic. And thanks to our relentless efforts to get more shots in arms, we are making progress. In the last 2 weeks alone, nearly 7 million Americans have rolled up their sleeves and gotten their first shot. 7 million, that's the highest 2-week total since the beginning of June. And over the past month, we've also seen a 75% increase in the average daily number of 12 to 15-year-olds getting vaccinated, particularly important as adolescents begin going back to school. And once the numbers from today are reported, we will have reached 200 million Americans with at least their first shot. 200 million Americans with at least one shot. That's a major milestone. Americans across the country are continuing to step up, do their part, and get vaccinated. We are using every lever at our disposal to fight the virus, including by ensuring state and local leaders have the tools and the resources they need to get more shots in arms and to respond to any outbreaks caused by Delta. Our COVID-19 surge response teams are a whole of government effort with experts and personnel and resources from HHS, CDC, FEMA, the Department of Defense, and the Department of Veterans Affairs. These surge response teams are now working with 16 states to address their particular needs, from deploying hundreds of personnel to provide medical care, to standing up free testing sites, to surging critical assets like ventilators and ambulance to strained health systems, to getting shots in arms, including through the use of mobile clinics, to sending and supporting the use of life-saving treatments. And we will continue working closely with states to do all that we can and to match resources to their needs. Just yesterday, President Biden directed FEMA to continue fully reimbursing states, tribes, and territories for all eligible COVID-19 emergency response costs through the end of the calendar year, a 3-month extension of the order he signed on his first full day in office. Importantly, this maintains 100% federal reimbursement for state deployments of National Guard personnel for critical COVID-19 missions. President Biden committed to the American people that he would do everything in his power to end this pandemic. And from his first day in office, the president has marshaled a wartime effort to do exactly that. We've been preparing for every scenario, including the potential need for vaccine booster shots. Our approach on booster shots is simple, and it's consistent with our approach on every other front of this war. Be guided by the science and always, always stay one step ahead of the virus. Now let me turn it to Dr. Murphy to discuss our booster plans, and then Drs. Walensky and Fauci to discuss the science behind the plan. Over to you, Dr. Murphy.
Well, thanks, Jeff, and it's good to be with all of you again today. Today, I want to update you about where we are regarding boosters for fully vaccinated individuals. Our top priority has always been protecting people and their families with from COVID-19. And we have been fortunate to have safe, effective vaccines COVID-19 boosters is now. Recent data makes clear that protection against mild and moderate disease has decreased over time. This is likely due to both waning immunity and the strength of the widespread Delta variant. Even though this new data affirms that vaccine protection remains high against the worst outcomes of COVID, we are concerned that this pattern of decline we are seeing will continue in the months ahead, which could lead to reduced protection against severe disease, hospitalization, and death. That is why today we are announcing our plan to stay ahead of this virus by being prepared to offer COVID-19 booster shots to fully vaccinated adults 18 years and older. They would be eligible for their booster shot 8 months after receiving their second dose of the Pfizer or Moderna mRNA vaccines. We plan to start this program the week of September 20th, 2021. I want to be very clear. This plan is pending the FDA conducting an independent evaluation of the safety and effectiveness of a third dose of the Pfizer and Moderna mRNA vaccines, and the CDC's Advisory Committee on Immunization Practices issuing booster dose recommendations based on a thorough review of the evidence. The plan ensures that people who were fully vaccinated earliest in the vaccination rollout will be eligible for a booster first. This includes our most vulnerable populations, like our healthcare providers, nursing home residents, and other seniors. We will also begin delivering booster shots directly to residents of long-term care facilities. For people who received the Johnson & Johnson vaccine, we anticipate vaccine boosters will likely be needed. The J&J vaccine was not administered in the US until March of 2021, and we expect more data on J&J in the coming weeks. With those data in hand, we will keep the public informed with a timely plan for J&J booster shots. I want to emphasize that this decision was not made lightly. It was made with careful consideration by the top medical and public health experts in the Department of Health and Human Services. It was informed by data, thoughtful analysis, and by our collective years of experience addressing illness and epidemics. As always, we will continue to follow the science on a daily basis, and will take whatever steps are necessary to protect our nation from COVID-19. This plan to administer booster doses does not change our commitment to vaccinating those who are not yet vaccinated here in the US and around the world. The overwhelming majority of hospitalizations and death continue to occur among the unvaccinated. We will continue to ramp up efforts to increase vaccinations here at home and to ensure people have accurate information about vaccines and access to vaccinations. We will also continue to expand our efforts to increase the supply of vaccines for other countries, building on the over 600 million doses we've already committed to donate globally. We understand well that global pandemics require a global response and strong leadership, and we will not stop until America and the world are vaccinated against COVID-19. I'm speaking to you today as your Surgeon General, but most importantly as a fellow American who has felt the pain of losing family members to this disease, and who hears each day the stories of people whose lives have been upended and forever altered by COVID-19. The brave doctors and nurses in our hospitals, the teachers working to get our kids back to school, and the frontline workers who have put themselves on the line to make sure we can get groceries and supplies. We all want this pandemic to be over. And right now, our quickest path to getting COVID-19 under control once and for all is getting vaccines to those who need them as quickly as possible. So here's what you need to know. If you are fully vaccinated, you still have a high degree of protection from the worst outcomes of COVID-19, severe disease, hospitalization, and death. So we are not recommending that you go out and get a booster today. Instead, starting the week of September 20th, fully vaccinated adults could begin getting their booster shots 8 months after their second shot of an mRNA vaccine. And finally, all of us must do everything we can to protect our communities from COVID-19. That means encouraging our family and friends, our patients and students, our coworkers and neighbors to get vaccinated. That is our path to ending this pandemic. I'll now turn it over to Dr. Walensky, who will walk us through some of the data that help inform our decision to take action now.
Good morning, Doctor. Good morning, everyone. And as Dr. Murthy mentioned, I want to provide an update on vaccine effectiveness. Today, we are releasing 3 articles in MMWR with data I will now describe that are helping to inform our booster plans. Recognizing that for most vaccines, there is a reduction in protection over time, we have been analyzing the data closely from a number of cohorts in the United States and around the world to understand how long protection from the initial COVID-19 vaccine series will last. Examining numerous cohorts through the end of July and early August, 3 points are now very clear. First, vaccine-induced protection against SARS-CoV-2 infection begins to decrease over time. Second, vaccine effectiveness against severe disease, hospitalization, and death remains relatively high. And third, vaccine effectiveness is generally decreased against the Delta variant. So let's jump into the data. On this slide, you will see 2 studies, one from New York and one an analysis of data from the Mayo Clinic. From May 3rd through July 25th, New York examined COVID-19 tests and linked them to individuals' vaccination status based on the state's vaccine records. This allowed New York to study vaccine effectiveness against infection over time for more than 10 million New Yorkers of all ages. Vaccine effectiveness in May, early during the vaccine rollout in the state, was 92%. In the later months, further from vaccination, vaccine effectiveness declined to 80%. These data will be published in the MMWR today. The Mayo Clinic analysis looked at vaccine effectiveness for both the Pfizer and Moderna vaccines among over 80,000 vaccinated and unvaccinated individuals across all age groups with data through July 16th. Like we saw in the New York data, vaccine effectiveness against infection declined over time. In this case, from 76% to 42% for those who received the Pfizer vaccine, and from 86% to 76% for those who received the Moderna vaccine. These data are currently available on a preprint server. Today, CDC will also publish data from our National Healthcare Safety Network, a nursing home cohort where we analyzed more than 85,000 weekly reports from more than 14,900 facilities. Weekly COVID-19 case counts were used to evaluate vaccine effectiveness over time. These data demonstrate that vaccine effectiveness declined over time from 75% in March to 53% as recently as August 1st, 2021. This represents a substantial decline in vaccine effectiveness against infection among those who are most vulnerable, including during months where Delta was the predominant circulating variant. Taken together, you can see that while the exact percentage of vaccine effectiveness over time differs depending on the cohort and setting studied, the data consistently demonstrate a reduction of vaccine effectiveness against infection over time. Importantly, though, despite waning vaccine effectiveness against infection, data analyzed through July continue to demonstrate a stable and highly effective protection against severe illness and hospitalization for people who are vaccinated. Included in the same reports described before, data from New York State and Mayo Clinic also show that vaccine effectiveness against hospitalization remains relatively high, both over time and during periods when the Delta variant was surging. CDC will also publish today in the MMWR data from the Ivy Network, which examines data over 3,000 adults admitted to 21 hospitals across 18 states between March and mid-July. This report compares vaccine effectiveness against hospitalizations early after vaccination, within 2 to 12 weeks, and later after vaccination, between 13 and 24 weeks, and found that vaccine effectiveness against hospitalization remained high. However, in this study, only about 7% of samples sequenced were the Delta variant. Taken together, these data confirm that while protection against infection may decrease over time, protection against severe disease and hospitalization is currently holding up pretty well. As we make decisions about boosters, though, we also have to look at vaccine effectiveness in the specific context of the Delta variant. Preliminary data through August 6th from 2 of our vaccine effectiveness cohort studies that include more than 4,000 healthcare personnel, first responders, and other frontline workers in 8 locations across the country show waning effectiveness against symptomatic and asymptomatic infection in the context of the Delta variant, from 92% prior to Delta to 64% with Delta. Notably, this analysis did not show difference over time, which suggests effectiveness is also decreased against Delta, independent of when you were vaccinated. These data suggest full vaccination in the context of the Delta variant may be correlated with less protection against SARS-CoV-2 infection than against prior variants. To be clear, our top priority is to save lives and prevent severe infections. The data we will publish today and next week demonstrate that vaccine effectiveness against SARS-CoV-2 infection is waning. And even though our vaccines are currently working well to prevent hospitalizations, we are seeing concerning evidence of waning vaccine effectiveness over time and against the Delta variant. Additionally, reports from our international colleagues, including Israel, suggest increased risk of severe disease amongst those vaccinated early. Given this body of evidence, we are concerned that the current strong protection against severe infection, hospitalization, and death could decrease in the months ahead, especially among those who are at higher risk or who were vaccinated earlier during the phases of our vaccination rollout. In the context of these concerns, we are planning for Americans to receive booster shots starting next month to maximize vaccine-induced protection. Our plan is to protect the American people and to stay ahead of this virus. Before I turn things over to Dr. Fauci to share the immunologic data informing our decisions, I want to emphasize one final thing. Our vaccines continue to offer the best protection against severe COVID illness. While we are still learning about how these vaccines perform over time and how long they will last against emerging variants, one thing is very clear. Getting vaccinated can keep you out of the hospital. Getting vaccinated can save your life. In areas with low vaccination coverage, we continue to hear far too many heartbreaking stories of people who did not get vaccinated, only then to get severe COVID-19. In these areas, the data are showing us that the more people who are in the hospital, and tragically, more people are dying of COVID-19. We are currently averaging over 500 COVID-19 deaths per day, and these remain largely preventable. If you are still unvaccinated, please get vaccinated. The single best action you can take to protect yourself and others is to simply get vaccinated in the first place. And now I will turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do over the next couple of minutes is provide you with the immunological basis that would support a third booster mRNA immunization. I will make 4 points and show you representative data from each of these. First, antibody levels decline over time. Second, higher levels of antibody are associated with higher levels of efficacy of the vaccine. Third, higher levels of antibody may be required to protect against the problematic Delta variant. And finally, a booster mRNA immunization increases antibody titers by at least 10-fold and likely much more. Next slide. So let's take the first concept, that antibody levels decline over time, in this case, following 2 mRNA immunizations, and that's regardless of the variant. So if you look at the horizontal axis, at day 29 is when you get your second shot. You can see the level of antibodies go up at 43 days, but look what happens at 119 and 209 days. Regardless of the variant involved, the antibody levels against those variants decline over time. Next slide. Next concept, that higher levels of antibody are associated with higher levels of vaccine efficacy. This is often referred to as an immune correlate. And this is a paper recently published in a preprint server. And what it shows is that a model of vaccine efficacy, in this case, based on the Moderna phase 3 trial, showed that 4 weeks after the second dose, that what you have is a serum neutralization titer of 1 to 100, which goes up from the vertical red line. That gives you an efficacy of 91%. But if you look at the dark black line going from left to right, as you go further up, you get a higher degree of efficacy. So the higher the neutralization titer, the higher degree of efficacy of the vaccine in this model. Next slide. Third issue, higher levels of antibody may be required to protect against Delta. And I'm showing you data now, both from Moderna on the left and a paper in the New England Journal has very similar data from Pfizer. So if you look at the left panel, what you're measuring is neutralization titer after 2 doses of the immunization. And the open circles are the same people as in the pink circles. And you're looking at the fact that the neutralization titer required to neutralize the standard prototype D614G, which was the original